jumbo. Let's talk about something that can be a real headache for a lot of us: health insurance. Especially that moment you look at your plan and just know this isn't working anymore. The idea of switching providers can feel, well, overwhelming, right? But it really doesn't have to be. Today, we're going to break down exactly how to switch your health insurance here in Kenya, turning what feels like a complicated mess into a clear, empowering plan. Let's get right into it.
I love this analogy because it just hits the nail on the head. Think about it. You wouldn't keep paying more for a matatu that takes a longer, bumpier route if there's a smarter, smoother, and cheaper way to get where you're going, would you? Of course not. And it's the exact same logic with your health cover. It's all about finding that better route for your family's health and, of course, for your wallet.
And look, this isn't just a clever saying. This is the reality for so many families. It is incredibly common to see a premium just shoot up from, say, 120,000 to 170,000 shillings in a single year. We heard about one family in Lavington whose premium jumped by a massive 40%. When you get a bill like that, suddenly the idea of finding a new route doesn't just sound smart, it sounds absolutely necessary.
Okay, so besides those crazy price hikes, what else is pushing people to switch? Well, maybe you've moved from Nairobi to Kisumu and suddenly your list of approved hospitals is practically empty. Or maybe every time you have to call your insurer, it feels like you're waiting for a delayed SGR train, just endless waiting and no answers. Or, hey, maybe you just see other companies offering way better perks, like telehealth or wellness programs. If any of that sounds familiar, trust me, you are definitely not alone.
All right, so we get the why. Now let's get into the when. And this is key. You've got to think strategically. These moments we're about to talk about, they're not problems. They're golden opportunities to stop, take a look at what you need, and make a much, much better choice.
Okay, timing is everything here. The absolute best, hands down, perfect time to make your move is during your renewal window. That's usually about 30 to 60 days before your current policy ends. But, life happens, right? Big events like getting married, having a baby, or starting a new job, those are also perfect triggers to review everything. And of course, if dealing with your insurer just feels like being stuck in Mombasa road traffic every single day, yeah, that's your sign. It's time to find a new route.
So you've made the call. It's time to switch. Now what? This next part is your roadmap. We're going to walk through the entire journey, step by step, to make it super clear and totally manageable. This is how you navigate the whole process with confidence. So that big question, where do you begin the journey? It all kicks off with having a clear plan. And don't worry, we've got the 5 key steps that will take you from feeling stuck to feeling totally in control. Here it is, your 5-step plan for a smooth switch. First, you do some solid research. Second, you take a hard look at your current policy. Third, you apply and you are 100% honest. Step 4 is critical. You have to make sure there's no gap in your coverage. And finally, you make it official and finalize the switch. See, when you break it down like this, it's not so scary, is it? All right, let's zoom in on step 1, the research. This is where an expert approach really makes a difference. We're talking about looking way beyond just the price tag. You got to ask the tough questions. What do their price increases look like year after year? Is my doctor, my family's preferred hospital, actually on their list? What are the limits on things like maternity or dental? And maybe, most importantly, how fast and easy is it to actually get a claim paid? This deep dive is what makes the difference between a great decision and a really big regret.
Okay, but like any journey, even with a great map, there are a few potholes you need to watch out for. So let's talk about the common mistakes that trip people up and, more importantly, how you can just drive right around them.
You want to know the number 1 mistake people make? It's this: looking only at the price. That's it. It is literally like choosing the cheapest matatu without even checking if the engine works or if it's going in the right direction. The smart approach is all about balance. It's finding that sweet spot between a price you can afford, a great network of hospitals, and benefits that will actually be there for you when you need them. And here are a few other traps you've got to avoid. A big one is overlooking waiting periods. You might sign up thinking you're covered for everything, but some benefits might not kick in for months. Another huge one, and please listen to this, is not disclosing your full medical history. That's like planting a financial time bomb. They can deny your claims later on. And never, ever assume 2 policies are the same. And for goodness sake, double check, then triple check that your favorite hospital is on the list. The details matter a lot.
Okay, all this theory is great, but what does it look like in real life? Let's check out a success story that really shows you the incredible power of navigating this process with some expert help. So let me introduce you to Mrs. Wanjiku. She's a teacher from Nakuru, and her story, well, it probably sounds pretty familiar to a lot of you. She had been with the same insurer for 8 years. 8 years of loyalty, and her reward was terrible service, and then, out of nowhere, a massive bill. She was just done.
And then this number landed. 35%. Can you imagine? A 35% hike on her family's premium just like that. That's not a small jump. That's a financial shockwave. And honestly, that was the final push she needed to get some help. So what happened next? This is where having a guide completely changes the game. First, they found and analyzed 3 really strong alternative plans, all with great hospital options right there in Nakuru. Then, they made sure to get quotes that would cover her husband's pre-existing hypertension. They handled all the boring paperwork, they negotiated to get some of those waiting periods waived, and, this is so important, they made sure there was a 3-day overlap in coverage. No gaps, no stress, just a seamless switch. And the result? Wow. Not only did she get a plan that was just as good, with even better service, she saved 20%. But that 20% wasn't just a number on a piece of paper. It was real. It was the money that paid for her daughter's school trip to Mombasa. That's the real-world impact of making a smart switch. So, I want to leave you with this one last question, and I want you to really think about it. Is your current health insurance bringing you actual peace of mind, or is it just another headache on your list? Your health cover is supposed to be your safety net, a source of security, not a source of stress. And knowing how to explore your options is the first, most powerful step toward making sure it is.